Hello, welcome to the Taussig Cancer Institute Survive and Thrive Virtual Support Group Series. My name is Jennifer Francois. I'm an oncology social worker in Medina Family Health Center. Today, our speaker will be Nancy Tamburro. She's an oncology social worker at our main campus, Taussig Cancer Institute. Okay, let's get started. Nancy?
Good morning. I'd like to begin by making an acknowledgement that if you are watching this, I want to applaud you because after 35 years of oncology social work practice, I firmly believe that the individuals who go beyond what is given to them by the nurses or the social workers or the physicians, but people who do their own search for education do best. And I want to applaud you for taking the time and the energy to watch this. Today we're going to discuss Scanxiety. On the right part of the screen, I found this image and I thought it was perfect because it says Scanxiety 101. And basically that's what we're going to talk about today. And everything on this front side is we're going to discuss. What is it? We're going to discuss what tools and other coping strategies we have that can help us cope with the anxiety caused by scans or any other tests, including blood work or other diagnostic procedures. And in addition to the emotional and psychological anxiety, we will also discuss what physical symptoms come across. Next slide, Jen. The objectives today will be to define what anxiety is. We're going to discuss what tools might be helpful, and then discuss the experiential. What can we learn from all of this, not only in terms of scans, but being diagnosed with cancer and having treatment for cancer. Next slide. So it was actually 11 years ago this month that the term Scanxiety was seen for the very first time in black and white. It was not written by a psychologist or an oncology social worker. It wasn't written by an oncologist or a nurse. The term was coined by a journalist named Bruce Feiler. Bruce was diagnosed with sarcoma, I believe, either in high school or in college. And as he was diagnosed with sarcoma, he was treated, and then it had metastasized to the lungs. Bruce is still with us, but as a journalist, he wrote the article for Time Magazine, and I actually have a copy of it right now on my desk. It was under the health section. It was health special, cancer. And he is the one that first coined it. And he says that anxiety is the often debilitating anxiety patients with cancer experience in the period surrounding imaging for their cancer. Since then, psychologists, psychiatrists, and social workers have done a lot of work with this whole phenomena of anxiety. And what we have come up with is it is probably the most common thing, emotion felt by all individuals who have cancer. To one degree or another, everyone experiences anxiety. So when I say it is common, it really should say it is universal, but it's also unwanted apprehension that is associated with any imaging or other diagnostic tests before the results are revealed. Some individuals will develop anxiety months before their scan. Some will be hours before the scan, but everyone experiences it to a certain degree, and everyone time experiencing anxiety will differ. It is also associated with physical distress, such as increased heart rate, as well as psychological, spiritual, and emotional distress. I think what we need to keep in mind is the anxiety is unwanted. Nobody wants it. Next slide. Thanks, Jen. So what are some of the symptoms associated with the anxiety? Well, there's trouble sleeping. You might be able to get to sleep, but at 2 o'clock in the morning, you wake up with a feeling of dread or a feeling of what if the scans reveal whatever. There is also a loss of appetite. We have found that there is faster heart rate and or higher blood pressure than usual. There are mood swings, and oftentimes people become more curt, more short. I don't want to say completely grouchy or grumpy or angry, but people who are even most pleasant will be a little more on edge. Some individuals will experience sadness, and I think most will experience worrisome thoughts. Because of this sadness, but more importantly, because of the worrisome thoughts, there is difficulty focusing and concentration. Even when families will say, oh, let's go for ice cream, or let's go on the sailboat, or let's go bowling. Things that might have brought a lot of pleasure or interest usually don't, because we are so focused on the worry and the fear of the scan. And of course, we know that the fear of the disease coming back or progression is really the number one fear. The other thing that I think is important to note, that although I'm talking about symptoms associated with the anxiety, these symptoms are not just for the person diagnosed with cancer and who's having this scan. It is not unusual. It is not unusual for family members to also have these same symptoms and these same unwanted feelings as it relates to upcoming scans, especially in families that are particularly close. And if a family member has been walking right beside the person who is diagnosed, sometimes, and we know that it's actually very helpful for the patient to use words like, when we first had our treatment, or when we first met the doctor, knowing that they're not alone. But it's also important for us to know that family members can experience this. Next slide. Yeah. And studies have shown that distress is most severe in the period leading up to the scan, or if it's another type of diagnostic test. So if you think of a graph, the highest peak of the line on the graph is the period leading up to the scan. That does not plummet down, but it does go down slightly after the scan. The other thing is, in 2022, there was a huge study done, and like we had talked on the previous slide, it shows that the anxiety is linked with a significantly reduced quality of life. So as we were talking earlier, people have difficulty concentrating, they're not getting pleasure out of anything, and they would just kind of sit. I had one mother, a young woman, who would look at her phone constantly and just read about when the test results might show up on her MyChart and things like that, that her 5-year-old had to tell her to put down the phone and read him a book, because things that she typically did that increased the quality of her life by spending time reading to a 5-year-old, she was unable to do. As I said earlier, everyone is different in the amount of anxiety they will have, as well as when they will have it. But we know that the anxiety will affect everyone. And one of the most important things to remember about the anxiety is it is not just in the present. It is really a three-time focus, because when we look in the past, most are diagnosed by a scan. Most people, whether it be a mammogram, whether it be a CAT scan of the abdomen pelvis, whether it be a CAT scan of the chest, the brain, prostate, most cancer is diagnosed. So when people have a scan, it does tend to resurrect the first time that they learn they had cancer. In the present, we learn then if the treatment is working or if it has worked. And then, as we know, scans are always related to our future. In the article that Bruce Feiler wrote for Time magazine, he said, if the scans are good, you go another 3 months or 6 months. If the scans are not good, then you return to treatment. And that does affect your future. Next slide. And the scan, once the scans are done and we're waiting for the results, as I said earlier, it's a reminder of our initial diagnosis. It's also uncertainty about the results in the future, but it also provides meaning and perhaps more of clarification, if you will, for the disease status and the course. And when I say that, it's not just implications for treatment, but oftentimes I will have patients say the scans were a mixed bag, meaning part of them shrunk, but other nodules grew or more nodules were found. And that does change the meaning of the disease. It changes the person's understanding of the treatment course. Next slide. So when we talk about scan anxiety, we know about scan anxiety with regard to what the scans may reveal. But sometimes individuals will have anxieties with regard to the actual procedure. And oftentimes it's unfamiliar equipment. For women who are getting an MRI of their breast, they are no longer standing up getting a mammogram. They are laying down on an MRI table with their breast in two distinct holes for the procedure. Some people will also experience claustrophobia. A lot of the procedures are uncomfortable, especially if it is with contrast and you have to either get it injected, and back in the old days where people had to drink their contrast. And for some people, there is great concern with regard to the radiation exposure. As we know, a lot of the diseases require scans every 3 months when someone is in treatment. And oftentimes patients will say, isn't that a lot? Isn't that what happens if the radiation that I'm being exposed to can cause a cancer? The other thing that I did not put on here, and it's really a very important factor, and I know Jen would agree, is the cost involved with scans. As we know, most of our radiology procedures, our scans, are probably the most expensive part of our medical bill, outside of maybe the administration of chemotherapy. With that said, people are well aware of copays and deductibles that maybe are not covered. So there is also the whole piece of financial distress as it relates to scans, as well as waiting for insurances to approve or authorize the scan. Next slide, Jen. So I went around, this is my own very informal, nothing please, nothing formal, where I ask people, tell me about your experience with scans. And the first one that I found was Bruce Feiler's, and it says, scans are like revolving doors. It's an emotional roulette wheel that spins us around for a few days and spits us out the other side. Land on red, we're in for another trip to cancer land, meaning treatment. Land on black, we have a few more months of freedom. Someone else has said, scans became my lifeline. So you live from one scan to another. One fellow said, I try to get the technician to tell me what they see. And then the last, and I just heard this a few months ago, and I thought this was probably the most poignant, is with each scan, I become more aware of what I have gained and what I can lose. We're going to talk about that toward the end of this presentation, but I think that that's very important, especially for people who are done with treatment, who have already heard that they have clear scans, that they have no need for other treatment, but with every 3 months, with every 6 months, with every year thereafter, we gain a lot. If we're living a growing after treatment lifestyle. Next slide. Other people have stated that there is a difference. They're not always anxious individuals, but they're anxious just because of the scan. So there is a distinct difference between general anxiety and scan anxiety. And again, I don't want to beat a dead horse, but what we have to remember for many, anxiety is not about what might happen, but it's also about what did happen. It's not so much worrying, it's about remembering. And I think one of the things that it's not just about remembering that you were diagnosed with cancer or that you had either surgery, radiation, chemotherapy, which also brought their own side effects. But for some people, I call it the shared pain, that they had to call their mother, who might have been older, saying, Mom, I've now been diagnosed with colon cancer. Or they've had to look at that 5-year-old child and say, I've been diagnosed with breast cancer. That shared pain, that emotional time. So it's remembering a lot of very difficult times and emotions. Next slide. Which brings us to why people have love-hate relationships with scans. I think we're all relieved that we live in the year 2025 because we have the technology that allows for medical diagnosis and treatment. And while we have all of that, we also experience fear or discomfort because of that, because those scans see more now in 2025 than they even did in 2020. So there is a love-hate relationship. It's a manifestation, particularly common when the emotions are intense. And, you know, it's like loving your baseball, football, basketball team. You love them, you support them. But then when they blow a game, we're not so much in love with them. But again, it's because the emotions are intense. The positive side, the love side of scans, as I said, is that it allows for medical diagnosis and treatment. It also allows us a sense of empowerment and understanding. And it shows the whole potential for success, that the treatment was successful, the surgery was successful. The negative, and probably why we're all watching this today, is that the intrusiveness of the thought and the lack of total control. And I think if nothing else, the diagnosis of cancer teaches all of us of how little, or it's a reminder of how little control we have in our lives. And I think scans and Scanxiety is a reaction to that loss of control. Next slide. So with all that, what are the factors that increase or reduce our skin anxiety? So if we're experiencing skin anxiety, what is going around us? What is going around us? And the first one is uncertainty. The ability, we have to acknowledge it and experience it. We are all on a whole different, we're all on different faces on the continuum of how we deal with uncertainty. Um, Myself and Jen have a job that we are very uncertain when we walk through our doors what the day is going to bring us. We probably have a higher threshold of working with uncertainty than someone who doesn't have that on a daily basis. Another factor that can increase our skin anxiety is our body has betrayed us in the past. So when someone's family member says, "Oh, the scan will be good. Look how good you look," or "Look how good how your energy is," or something like that. How many of us felt very good before the scan showed whatever diagnosis it was? Our body has betrayed us in the past, and it has the potential to doing it now. The anxiety makes us face things we cannot control. And none of us like to have little or no control. And I think that the not knowing and not having control as to whether the treatment works or not has to be extremely debilitating. We also, and I think we as Americans are more like this, and we need to know what is coming next. We need to be prepared. It's almost like the fight or flight syndrome. I think we all do better when we have a plan and when we're prepared for something. And then last, I put down friends and family. They can also be very helpful. They can be very supportive, but it's also not always helpful or supportive to get continual texts or telephone. "Did you get the results yet? What did the doctor say? Oh, don't get worried. You look good." We gotta be able to shepherd our friends and our families through this time and tell them, "I'm going to be a little more anxious than usual because I'm waiting for the scan and or waiting for the result." Next slide. So what are the tools that we need to consider? And I wrote some down, and I think we're all very different, but I think that these are probably the very best tools to consider when we are experiencing anxiety. And the first one is self-care. And please, that is not something that should begin a month before the scan is scheduled. That is not something that should begin a week before. That is something that should begin as we speak today. Taking care of ourselves is probably the number one thing that we need to do. And when we talk about self-care, I know I work with people who believe manicures are good self-care, and they are, or a good massage. But let's get right down to the basics. I think getting enough sleep, because as we know, or at least for myself, when I don't get enough sleep, everything is bigger the next day. So let's practice our sleep hygiene long before any scans. We should also, if we do have sleep hygiene problems, we should either have them addressed by our primary care physician, an oncology psychologist, or palliative medicine. That is important. The other area of self-care will be exercise. And anyone who I work with, I always talk about the importance of staying active and to do exercise. I am not talking about running a marathon. I am not talking about jump boxing or anything extreme. I am talking about getting into a consistent daily exercise program, whether it be walking mixed with some weight training or resistance training. For those of you who live in Northeast Ohio and even those out of state, we are very fortunate to have a wellness center called the Gathering Place here in the Cleveland area. They are the only wellness center that I am aware of in Northeast Ohio that has both a personal trainer who has advanced credentials in working with people through treatment, as well as an occupational therapist who head up this program. Some of their programs are virtual and can be done on the computer. There is a very well-known, I think she calls herself, I think an physiatrist, and her name is Dr. Catherine Schmidt. She is with the Hillman Cancer Center in Pittsburgh, Pennsylvania, and she has written a book, Moving Through Cancer, where she outlines every type of activity or exercise that is good during chemotherapy, during radiation, and after surgery. So exercise is huge. And then the last thing with self-care is diet. And you know, diet is like everything. It is something that we can control. What we put in our mouths, how much we eat, that is definitely self-care. And when we can get a nutritious diet, that helps buoy our mood, as well as doesn't allow for the spike in sugar that, like maybe sweets or carbohydrates, right? The second tool that we have to consider is acknowledging our emotion. When we are anxious, it's always good to appreciate and say, I am anxious, but we have to go deeper. What is causing my anxiety? And for some people, we do that by journaling. So what is causing my anxiety? Fear that and write these down, you know, is it fear that my disease is going to return? Is it fear that I don't want to go on the PET scan? Is it fear that I'm going to have to stop working? Is it fear that it's going to hurt my family if I have to go back to treatment? Is it fear that I don't want to go back to treatment? But to acknowledge your emotion and write down what exactly it is. Journaling is a great tool. For some people, journaling might not be their thing. And at that point, I would suggest any of the expressive therapies, such as music or art therapy. I know here at the main campus, both Megan Denty, our music therapist, and Lisa Shea, our art therapist, would be more than willing to work in ways of finding ways to for you to express and acknowledge your emotions through their program. The next tool is to plan ahead. And that actually is planning either starting the day before the scan or the day of the scan. I tell people when you are scheduling your scan, try to get it for the first thing in the morning. This way you're not doing the day of. You've already, like if you're the 8 o'clock slot or the 6:45 or whenever they start scanning, be the first one. Plan who are you going to go with, or are you going to go alone? Where are you going to park? How much time do you need to get there? Where are you going to have the scan? Plan ahead. Then once the scan is done, what is our plan thereafter? Okay, so planning ahead also means planning for what happens after. So talk to your doctor well before the scan. How long do you think it will take for the results to come in? How will you notify me? If the doctor says, I will notify you by my chart, and you would rather hear the results of the scan face to face, verbalize how you want to be told. These are ways that we can exercise control and at the same time reduce feelings of not being in control. So right from the get-go, plan for the day, but even before you plan for the day, talk to your medical team and tell them how you want the results done. Once the scan is over, what are we going to do to distract ourselves from worrying? Some people plan a special lunch with friends. Some people return to work. Everybody is different, but have a distraction plan and know that that distraction plan is not just for 24 hours, but it could probably be up to a week, depending on when the scan results come. Seek support. As I said earlier, it may be with family and friends. It might be developing a relationship with a medical psychologist. It might be working with a coworker on a special project, but seek support. And if none of the above works, call your social worker. We are more than willing and able to help acknowledge your feelings and explore those feelings and find ways to help you reduce that anxiety. And for those who do come to the main campus, we have reflections. For some people, having a massage or a facial can also be very relaxing and help reduce the anxiety associated with the scan. Jen, next slide. So, and I think this is very important, what scans can trigger. And it also has a lot to do with cancer survivorship as a whole. But one of the things that we as social workers look for right in the beginning, has there ever been a history of trauma? And the reason I bring this up is trauma, especially at younger age. Individuals are more likely to have some trauma stress disorder. And if you look at this slide, research has shown that 4 to 22% of all cancer survivors are diagnosed with post-traumatic stress disorder. We have learned that children who have survived childhood cancer are more likely to have PTSD than adults who are diagnosed with cancer. We have also learned that individuals diagnosed with breast cancer, especially those diagnosed with breast cancer when it's more advanced and have had long surgeries and prolonged radiation, have a history of trauma as well. So we want to reduce post-trauma stress because that will also not only be a trigger for scanxiety, but the scans can also trigger that stress disorder. What I'd like to spend time on now, and I was talking about this earlier, is the post-traumatic growth. It's more common than those of psychiatric disorders. So the next slide is going to talk about when to seek help with post-traumatic stress, and then we're going to concentrate on the next post-traumatic stress. Next slide. Okay. These are bullets, but I want to discuss them in detail because this is when we need to seek help. If we're having nightmares or flashbacks, either about any trauma that we may have experienced when we were diagnosed or treated for cancer, or even other trauma in the past. I spent part of my career working, having my office in radiation therapy. And one of the things that I learned, and anyone who's been in a patient who has had radiation know that you're in this room alone. There's probably the doors are at least 2 feet thick, and they're shut. And even though there is lights going on and you're able to communicate with the radiation therapist by microphone, it is still a very confining space. And anyone who has ever experienced the trauma of being mugged, robbed, and unfortunately raped will have a higher degree of post-trauma stress when they're going through treatment. So it's really important when you meet with the social worker or even your own medical oncologist or whoever that trusting person on your team is to let them know, not to relive this, but to let them know so that we can better plan for the treatment, as well as provide for resources that might be helpful. Avoid places and events and people that bring back memories. Probably about 2 hours before today's presentation, I was waiting for a patient who was in treatment. He was coming out. And while I was sitting there, I'm looking at this woman and I'm looking at her. I'm like, she's so-and-so's wife, but so-and-so passed away about 2 years ago. And we come up to each other because she recognized me about the same time. And we talked, and she was here for her brother-in-law. And we talked about coming back into the cancer center. And for some people, that can resurrect some trauma. So remember that even when you come back, maybe after being away from treatment for 6 months or 3 months, be aware that that might trigger feelings. And if they really are strong, let's talk about seeking help. Whenever there's strong feelings of guilt or hopelessness or shame, I think those are sometimes symptoms of post-traumatic stress and time to seek help. I think that there are certain diseases that people feel very guilty as if they have brought it on. And one of them, of course, as we know, would be lung cancer, because good or bad, lung cancer is always associated with smoking cigarettes. We know that there are people who are 97 years old who are probably lighting up a non-filtered pulmonal right now and doing well. And we know that there are people who get lung cancer who have never smoked. But regardless, guilt always implies that we have done something wrong. Explore that with a trusted mental health professional. And the same thing with shame. And above all, the sense of hopelessness. Because if we have no hope, that's a very desperate place to be. And we all need hope to sustain. Sometimes that hope is changed, but we all need hope to sustain. As I said in the previous slide, if you are experiencing trouble sleeping or concentrating, please tell your doctors. Your primary care might be able to help with it. We also have palliative medicine in the cancer center that will also be able to address it. If you have continuous feelings of fear and anger, please seek help. If we are so anxious and afraid, that can be debilitating. And oftentimes anger masks depression. So those are something we have to take into account and keep tabs on all of that. Self-destructive behavior, when we don't drink enough water to stay hydrated, when we don't eat enough, when we miss appointments, those are also indicators that we may need to seek mental health. And of course, the last 2 bullets, which is the frightening or the unwanted thoughts, whether it's about previous trauma or whether it's about fear of what scans may show. If they are debilitating and they're unwanted, we really need to seek help for that, because without that, we put ourselves at risk for post-trauma. And last, difficulty feeling emotion. Sometimes people are brought up in families or environments where um, crying was not allowed or being angry was not allowed, and then all of a sudden we're 57 years old and we're having these feelings, and we have no avenue of how to express it, or we don't understand why we're having them. Please seek help. Next slide. I'd like now to concentrate a little bit more on post-traumatic growth in cancer. I want to end on a positive note. This post-traumatic growth is a concept that came about in the mid-90s. There were two researchers at the University of North Carolina, Dr. Richard Tedesco and Dr. Lawrence Calhoun, who came up with this. And it's really the path that most people take after they have been treated for cancer successfully. And even those where maybe the prognosis isn't as successful as it might have been, but it's a process of developing positive changes within or in the struggle with the trauma or with the sheer distress of a cancer diagnosis, treatment, and following scan. Post-traumatic growth is not a given, and it's not easy, but it allows us to find meaning, strength, and hopefully gain a new perspective on life after the treatment or after the diagnosis. And even individuals who are on treatment for life can experience post-traumatic growth. It's actually probably what has kept me in my field for 35 years, is to be able to see the exciting growth, the exciting strength, the resiliency, and the whole will of individuals to accept a diagnosis of which they have no control, a diagnosis of which they did not ask for, and to be able to adjust to a different lifestyle and do it with such graciousness and growth. It's quite exciting. And it allows us to improve relationships with others. I can't remember the name of the cancer center, but they did this great study with couples, and they had support groups. And one of the things that they learned is that couples who say we, they found that those couples actually have improved their relationship since the diagnosis of cancer. And that improvement of their relationship not only enhanced their emotional and psychological lives, it also helped with physical. Those patients were less likely to have dose reduction than individuals who might not have had that kind of improved relations. It allows for new life experiences. I think that we all think of, oh, the trip or the new car or the new house, but actually new life experiences could be, you know what, I'm going to take next Thursday off, I'm going to keep it as my secret, and it's going to be my own personal, with the Ferris Bueller's day off, like just to have new experiences, to maybe go to a park that you have never gone to before, to be open to new things, which also allows for a greater appreciation of life, which goes back to one of my very first slides when Becky said with each scan, she is more aware of what she can lose because she has gained so much. So it allows us to know that we really have many, many good things in life and there's much to appreciate. One of the things that I often remind my patients when they are experiencing anxiety or any difficulty as it relates to treatment and diagnosis is their own sense of personal strength. Both Jen and I have learned that the strength perspective approach to social work practice, or really any of practice, is the best. Look at your personal strengths. What I remind people of how much they have surmounted so far. You sat in a room, you sat on the telephone, you read something that rocked your world. The first time your physician said, you've been diagnosed with a cancer, or I have bad news to tell you. You surmounted that. And that takes an enormous amount of strength, resilience, and above all, fortitude, because you needed that fortitude then to meet with the nurse to hear what type of treatment you were going to get, the side effects of that treatment. Please give yourself credit for all of that strength. And then for most people, and I want to talk about spiritual growth, and this is not necessarily about religiosity, but spiritual growth is that sense of gratitude, those relationships with ourselves, those relationships with others, and if you have a higher power. Spiritual growth is the reason that we have pink ribbons. Spiritual growth is the reason we have a lot of cancer funds. Jen works at Medina, and there was a very, very benevolent family that had a fund for many, many, many years. But that fund was because the husband grew spiritually from his wife's diagnosis. They wanted to help other people. And I think that maybe we can't all start a fund or a program, but we can all express gratitude, thanking people. There was a study done at the Brookings Institute of people going through treatment for cancer, and they found that individuals who were able to express gratitude not only did better mentally, they actually lived longer than the person that said, why me? Or they're late with my chemo, or I had to wait to see the doctor. So these 5 pillars are essential for us while we're going through treatment, but also after we're done with treatment. And I think if we can practice living with these 5 pillars or incorporating them in our lives, we're going to be more able to withstand the real paralysis of anxiety. This ends my portion of the program. I'm going to ask Jen to ask, I was going to say to ask any questions, but we both thank you very, very much for your time. As I said in the beginning of this, I am so thrilled that you took the time to look this program up to empower yourself. I wish you nothing but peace on your journey. Thank you.
Oh, thank you so much, Nancy. That was a wonderful presentation full of amazing information. I did want to mention, if anyone has any questions, please reach out to the Cancer Answer Line at 1-866-223-8100. And I wanted to make note that there is a place called Stewart's Caring Place in Medina County that offers the same kind of supportive services that the Gathering Place does, including things like the Reiki, massage, yoga, support groups, counseling. They have lawyers that volunteer their time as well as donated WIC. So it's a great resource.
They have a spinning bowl, which is also very relaxed. Yeah.
Yes, that's a great one for the ScanNet. Okay, we're going to sign off. Thank you. Have a great day.
Thank you.